Okay guys, so I want to make this video about something that I really couldn't find any videos on YouTube when I was like researching this and everything. So there's a couple videos, there might be like 2 or 3, but there's really not a lot of information out there on HMG, which is human menopausal gonadotropins, HMG. We'll call it that for short, makes it a lot easier. Anyway, this is a drug that will help you gain your fertility back after having run anabolic steroids or even using testosterone. Because what happens is testosterone, anabolic steroids, they make it so your pituitary gland is no longer producing GnRH, and GnRH is responsible, and it's basically the main regulator for FSH and LH. So what does all this mean? I'm going to try to make it fairly simple. Like you can read up on this stuff all over, but I'm going to try to make this as simple as I can. So basically, pituitary gland is in your brain. It's the main hormone regulator. The pituitary gland helps produce GnRH. GnRH is the mechanism that produces LH and FSH, luteinizing hormone, and follicle stimulating hormone. So what are these? So luteinizing hormone is basically what produces testosterone in the body. So obviously you need that. That's what everybody has before they take anything. You have a certain amount of luteinizing hormone. The scale runs from like roughly 2 up to 12. Actually, I have an old blood panel here from 2014. So this was when I was on steroids for 4 years at this point. Or I think this was 3 years I'd been on. 3 years I'd been on at this point. My luteinizing hormone was 0.1 milli-international units per milliliter. So MIU per ml is what it's measured in. And the scale here on this blood test says that it runs from 1.7 to 8.6. I was at a 0.1, so I was way below zero, or way below normal, because testosterone and anabolics, they shut down your natural production. So you're not producing testosterone, your LH falls to basically nothing, 0.1, barely shows up. So the other half of the equation, though, that gets shut down is your FSH, follicle stimulating hormone. And this basically is what controls sperm production. So obviously that's pretty important too as far as fertility goes and all that. This is where people always think like anabolics shuts you down, and they do, but it's possible to gain that back, which is where HMG comes into play. But this was 2014. My FSH was 0.2 or less than 0.2, it said, on a scale of 1.5 to 12.4 milli-international units per milliliter. So basically my FSH and LH was nothing for the whole time I've been on this stuff, and I've been on for 9 years now. So right now I'm 57 days off anabolics and testosterone. I did a post-cycle therapy, and this is where I was trying to research about HMG, because it's not something you hear about a lot. You hear, everybody always talks about with the post-cycle therapy, they talk about HCG, Clomid, Nolvadex, estrogen blockers, Arimidex, Aromasin, things like that, but you really don't hear about HMG too much. It's a newer thing. I credit Dave Palumbo of RX Muscle for kind of like bringing it to the forefront. He seems to be the first one to do that, and then Boston Lloyd kind of talked about it as well, for gaining your natural testosterone production and sperm production back. So basically most people just do a PCT, HCG, Clomid, maybe an estrogen blocker, Arimidex in there, and that's it. And it's not that simple. I'll make a separate video later on post-cycle therapy, the importance of it, what I would do, all that kind of stuff, what I did. But basically HMG is this thing that hardly anybody knows about. Like doctors in the US aren't big into prescribing it. And the thing with all of these fertility medications is they were first used for women, and then obviously they've been used for men now. So they work on both sides of the equation, basically. But HMG isn't something that gets prescribed much in the US. HCG gets prescribed a lot more from doctors as far as restoring fertility in men. You don't see HMG for whatever reason as much. And you can also, HMG is like a fancy word for FSH. So you also see synthetic FSH, but again, it's not as common in the US as it is overseas. The thing is, I think HMG may be an even bigger part of the equation than HCG when it comes to restoring everything. So with HCG, I personally was doing 2,500 IUs every other day for about a 16-day period initially when I first came off the testosterone. So 2,500 IUs, fairly high dose of HCG. That's half of an ampule. And I didn't feel a ton from the HCG, but once I introduced HMG into the equation, and I did HMG over a 16-day period as well, at 75 IUs per day, which is a full amp. And it's very expensive. That's the other half of the equation. HMG is much more expensive than HCG, so doctors don't use it as much. You just don't see it as much. It's harder to get a hold of. But I didn't run these at exactly the same period. So I kind of ran HCG first and then introduced HMG a week or two later. But I felt way more from HMG. I felt more recovered. I felt more normal. I felt like everything was bouncing back. And I just did a 2-week period of that, basically alternating 75 IUs. It's one of those things you want to look into if you're going to do a post-cycle therapy. You're going to have to pay a little more for the HMG, but I think it's worth it in the long run because you're going to restore not only your testosterone production, but your sperm production. And that's pretty important as far as fertility and all that is concerned. So HCG, it's been said, can also stimulate FSH, but from every study I've looked at, there's a bunch of them if you Google, you get a much better result when combining the two, when you target FSH and LH. So that's why it's probably the way to go. A lot of people don't even know about it, which is crazy, because you can find tons of stuff about HCG, but not that much about HMG. And it's one of those things to look into. So obviously you run HCG, HMG before you run the Clomid or Novadex. And I actually ran both Clomid and Novadex after discontinuing with those to kickstart the natural test production. And I had an estrogen blocker in there as well. Estrogen blocker, basically you want to keep your estrogen levels down when you're coming off testosterone or anabolics, because if your estrogen is too high, your body's not going to make the signal to the pituitary gland to start testosterone production. So you got to make sure estrogen's in check as well, and that's an important part of the protocol. So it's fairly complicated, but I'm trying to simplify it as much as possible. I don't know if I did, but this video, HMG is an important PCT protocol drug that I would utilize to help you get back to your natural level. So like I said, I'm on day 57 of being off testosterone and PCT and all that, and I'm going to get blood work done in 3 days. Actually 2 days. So today's day 58. I'm going to get blood work done in 2 days, the 60 day mark, 2 months in. Going to see where my levels are at as far as testosterone, total testosterone, estradiol. I'm going to see where that's at. I'm going to see where luteinizing hormone is at, and then FSH. So those are the main things I want to get checked out. I'm going to also get some hematocrit and all that kind of stuff checked as well. But the main ones I'm concerned about are to see how my LH and FSH are bouncing back, which in turn will determine my testosterone levels. So I feel pretty good at this point. This week I started feeling a lot better than the previous couple of weeks. So I've been on for 9 years, so it was very hard for me to bounce back. So I recommend doing a PCT more often than this. Like, I wouldn't wait 10 years to freaking PCT. You're gonna be shut down really hard. So I was shut down really, really hard, and I'm starting to come back now, but it's just taking time. And I'm sure over the next couple months it's gonna get even better. But the big thing is just I would PCT every 2 or 3 years at least. And you know, some people would say PCT after every cycle or anything like that, but I know in powerlifting nobody actually cycles, they just run all year round. That's the true nature of the sport. But as far as just being healthy, I think it's a good idea to come off every once in a while. You know, I'm nearing 30 now, I'm 29 years old, so a lot of my views on this stuff have changed, and I'm not as reckless as I was throughout my 20s, where I'm starting to think about other things in the future and recovering and building my natural base up and all that stuff. So PCT definitely has merit. It's a lot more expensive than just continuing on a cruise dose or hormone replacement therapy. But I think it's good as far as resetting the receptors and all that kind of stuff, cleaning everything out, getting healthy. And if you're looking for more information on this, Dave Palumbo's got some good videos about HMG, HCG, PCT, all these acronyms, and check that out. But I appreciate you guys watching. If you're interested in coaching, shoot me an email at prstrength1@gmail.com. And I'm out.